Welcome back to the DAMY vlog. My name is Dr. David Duizer. Thank you so much for tuning in. On this program, we talk about all things holistic health and wellness related. If optimizing your health from a holistic standpoint is what you're interested in doing, please subscribe to our channel. We're going to be posting here frequently. My name is Dr. David Duizer. I'm a naturopathic doctor in Vancouver, British Columbia, and the medical director at DAMYhealth.com, the premier site for the holistic approach to weight loss. So thanks for tuning in. Let's jump into today's episode. Today we're talking about the 5 risks of going keto. If you're not familiar with the keto diet or being in ketosis, it means when you're running on fat instead of sugar. It's a very popular diet at the current time, and some people find it incredibly effective. It very commonly is effective for weight loss. Clinically and naturopathically, we use it in a few different situations. Traditionally, it's been used in brain cancer and epilepsy. Now we use it when someone is initially diagnosed with diabetes. We also use it for people who have a very, very difficult time losing weight and need a jump start. Today we're talking about the risks, because this diet does not come without risks or consequences. The keto diet means basically completely avoiding carbohydrates. You want to keep your carbohydrates down to about 30 grams per day. That seems to be the spot where people have the best success and are able to get into what's called ketosis most efficiently. And they're able to stay in it when they maintain their carbohydrates at that level per day. The problems. When you avoid carbs so strictly, a few things can happen. Number one, the most common thing that people report is constipation. When soluble fiber goes down in the form of the restriction of carbohydrates, some people become constipated, and that can be a problem, and we know it's really bad for long-term health. It's also very uncomfortable. Number two, when you become constipated, there's potential for colon health issues. We're thinking about diverticulitis, diverticulosis, we're thinking about imbalance in normal flora, and we're thinking about maldigestion, we're thinking about a host of other things. We know that healthy grains have been associated with a decreased risk of colon cancer. So whenever someone's going on a strict carbohydrate restriction diet, like the keto diet, we worry about their colon. So colon health has to be on the list. We have to keep the colon healthy if someone really needs to start a program like this. Number 3 would be emotional instability. So sometimes when people are running strictly on ketones, they feel very, very good. Then there can be a crash. There can be what's called keto flu. There can be a period of feeling unwell. That's a common pattern. People feel good, then they feel unwell, and they feel good again. Some people have swings on a day-to-day basis. They have swings with meals. They have swings depending on their fatigue level. They have swings with stress. It's something to watch out for if you've begun this diet. Emotional instability would be high up on the list of the risks. Number 4, along the lines of emotional instability, is that in this life, it can be difficult, very, very difficult, to keep your carbohydrates at 30 grams per day, especially with holidays, with parties, with exposures to carbs. On this diet, really, with 30 grams is like 1 or 1.5 pieces of fruit. It's a very low amount of carbohydrates. There will be times in your future when you're exposed to carbs again. You're probably going to eat them. Some people, their metabolism then does not respond to that quick change in energy source, that quick change in fuel source. Some people have a hard time going from using ketones for fuel to using sugar again for fuel. When that happens, there can be symptoms like detoxification symptoms, like fatigue, again, emotional instability or irritability. There can be skin inflammatory symptoms like acne. Some people just have a very difficult time switching their fuel source so quickly. There will be carbs in your life again. You will be exposed to them. You're probably going to eat them again. So this has to be on the list of risks of going into ketosis, that exposure to carbs and not being able to hold on to maintain your health with the reintroduction. Number 5 on the list, the last thing we'll cover today, is nutrient intake and overall nutrient levels. So when you avoid carbs, you're going to be missing some things. Certain things we get from carbohydrates would be things like minerals. If you're not eating a well-rounded keto diet, so if you're not eating a broad spectrum of fruits, or a broad spectrum of vegetables, sorry for that correction, if you're not eating a broad spectrum of vegetables, if you're not eating an assortment of different fat sources, if you're not eating, for example, if you're going with lectin free as well, if you're avoiding beans and legumes, nuts and seeds completely, there's probably going to be some deficiencies involved, and you have to watch out for that. So when someone's gone keto, or if they need to go keto for a medical purpose, we have to make sure that mineral status stays appropriate and nutrient status stays appropriate in the sense of vitamins. So we always monitor that clinically. Those are really the 5 risks of going keto that are important to keep in mind when you start a program like this. So, nutrient deficiency, colon health, constipation, emotional instability, and that inability to then have the metabolic switch to using carbs again when you need to. Some people just can't do it. If you enjoy content like this, please subscribe. We're going to be covering all things holistic health and wellness on this channel. Again, my name is Dr. David Duizer. Thank you so much for tuning in, and hope you have a great day.